distinguished delegates for the QPCon. Let me, at the outset itself, thank the organizers for giving me an opportunity to interact with you. The topic assigned is a difficult task, patient-doctor relationship, which is a thing which you cannot by any means solve it, but you can, as you may gain more experience, you can try to solve more of the problems and improve the doctor-patient relationship. The key factor in the health sector is definitely doctor-patient relationship. Here the conflict is the expectation of the patient and how best we can deliver the goods as per their expectation, which definitely is becoming much more complex and difficult with the internet and the Google and other newer areas of information, where when a patient has a disease, they definitely go through all these media to get more information about their disease, and they come more equipped than you, and you can really understand what their expectation is. It's not highly educated people. Anybody has now, even a schoolboy has an access to internet. So that is another challenge that we face. Generally, when you look at it, the expectation of the patient is that your service will be available. If you treat a patient, your service will be available for 24 hours. At any time they call you, you should be available. And there is a very high expectation on many times. It may be impracticable to provide that. Second is, of course, they should be given the best treatment available under the sun, and that only can satisfy them. And it has to be cheapest. The cost factor, again, they are very particular that it has to be cheapest. So these are the challenges that we face. In India, traditionally, healthcare is definitely something which has been given free of charge. It is a service that saints and other people used to give to the patient. So that concept still has not faded. That's why, in spite of all the turbulence in the health sector, doctors are still considered as God or demigod. That impression still remains. And with the impression, the expectation is also very high. Then, of course, in olden days, we know, even within our practice period, we know initially when the patient comes, they are satisfied with what you do. And they have an impression that doctor has done the best for the patient. And it is a fate that they could not save or could save or whatever. And it has been an agrarian society. And this mindset persisted for a long time. Now things are different. They are very critical about what you offer and what you do to the patient. And the patient feels that even the choice of treatment has to be discussed with the patient. You cannot be sitting on judgment as to what is best for the patient. Even if you think the best for the patient is something, the patient and relatives do demand that they have to be part of the decision making, and they will decide what is best for the patient from the input that you give. Here again, if some failure happens, the patient still put the blame on you. You are not really sort of briefed them all the dimensions of the treatment that finally you have chosen. And still the blame is on you. So this is a situation where you are. Even the decision making, they feel they have a role. And even if the decision making fails or that mode of treatment fails, still the blame will be on you. Then, of course, the rapid commercialization of healthcare, the way the healthcare scenario is going, it is becoming more and more expensive. Not only that you give the best of the treatment, but even other hospitality aspects they feel is very important. Even some delay, they are not ready to accept. And they have to be pampered, all facilities to be given. And all these are really a strain on the health sector. And normally, they do spiral the cost of treatment. Then the dilemma of the doctor is that even medical education, you know how expensive it is becoming. It is so expensive that you cannot even publicly talk as to how much you pay for your basic education or postgraduate education. And then the doctor feels that he has to make up the money he has invested. And that is the conflict. So the conflict of the doctor is keeping high standards of ethics, at the same time satisfying the patient in terms of expense and treatment. So this balancing act, which is what we'll have to do, and it can sometimes be very, very demanding from their side. Of course, communication is the essence of your doctor-patient relationship. When you say communication, it is not always the verbal communication. Verbal communication may be playing a small part. In IMA crowd, we always say that when a patient comes to you, some of the patient you can save. Some of them you can save, but the quality will be less. And some, whatever you do, you cannot save at all. But then, if you have a compassion, empathy, a feeling of feeling the distress of the patient in your expression and mind, definitely you can get through that patient. But most of the time, even this we are not able to provide. In the high-tech world, when a doctor is in the consultation room, he has a cell phone or laptop in front. And even when the patient is talking to you, you may be looking at the laptop or cell phone. And such distractions, even at the first opportunity to meet the patient, if it is there, then their impression about you will be very bad. And even the seating, if you look at it, you always sit at an executive chair at a higher level, and the patient will be sitting on a stool or plastic chair. And there itself, the discrimination between doctor and patient starts there itself. Whoever may be the patient, this is what physically that you are offering the patient. In their mind, they will have a feeling that what is this doctor doing? Are we not equal human beings? So from there, the conflict can start off. Then, of course, if you are not listening to the patient properly, again, the confidence is lost. And the best way of communication is how much do you listen to the patient. So that is what, if you look at some of the advertisements, you see that ചുമ്മാ ഇരുന്നാലും നേടാമെന്നൊക്കെ പറയുന്ന പോലെ പല സാഹചര്യങ്ങളിലും ചുമ്മാ ഇരിക്കുന്നതായിരിക്കും, അധികം സംസാരിക്കാതെ കേട്ടുകൊണ്ടിരിക്കുന്നതായിരിക്കും കുറച്ചുകൂടെ നല്ലത്. And that is what essentially is required. We are listening to all that they say. We may feel that they may even say so many stupid things, and you will be in your arrogance say that if they know the diagnosis and treatment, why they should come to us. that sort of a attitude, at least in your mind, which definitely get reflected in the conversation also, then you have a problem. So the first step is building confidence between the patient and doctor. The first step itself, you have to give an impression to the patient that he is sitting before a doctor in whom he can safely entrust his life and he will take care. So if that impression you can create, then definitely you are going to succeed. So that is the key and essence of doctor-patient relation. Be a good listener, have an eye-to-eye contact. Your body language has to be perfect, where the needed seriousness is there, the way you sit, and all those things definitely count. Then, of course, when you have a patient, their background, social background, psychological background, the life through which they have come through, all these count. We used to say that patient, you can have a chronological age, psychological age, emotional age, educational age, and all these are there. So we are not one-to-one when you are dealing with the patient. Patient may have a mental age which may be much less. So when they start arguing, we have to realize that his mental age is less than his chronological or physical age, and we have to be careful to the way you respond to them. So like that, there are various factors which definitely help you in building confidence. And then, of course, 1 or 2 points only I'm adding on because I know there is a short of time, is that you have to have a continuity of treatment, and whenever you suggest some treatment or investigation, that is not the ultimate. You should not give an impression that if they have given us, say, seen a doctor and what has been done is the last thing that you are going to do. If they have problem or allergic reaction, they go to another doctor, and nowadays you know how the other doctors respond. And if something in their words or their body language, some expression of insufficiency of treatment is conveyed, you know that is the end of it, and a patient is immediately converted into a hostile person. So don't have the ultimate, don't give the impression that what you have suggested is the ultimate. Do room for further management, treatment, newer investigations. Tell them even if there's an allergic reaction, you give your number to contact so that the interaction continues. Even when you discharge, you may have to mention something about for what and what problems you have to again contact, how urgently you have to contact. So such communications, written documents definitely help you to have a better relationship with the patient, and that can reduce quite a lot of your tension. Your availability is very important. At any time if the patient calls you, if you are there to respond to their call, then to a large extent you can satisfy their demands. So with this small introduction on doctor-patient relationship communication, I am closing the topic because there are many other topics to be discussed in this meeting. And I once again thank the organizers for giving me the opportunity. Thank you.